Welcome back to another Southeast Ohio QI Hub video. Today we are joined by Dr. Amber Healy, who had an opportunity to go to the American Diabetes Association, the ADA, scientific sessions in June. She's going to give us a great clinical summary of what was her favorite there.
There are always a lot of clinical highlights, and a lot of people they seem to save up for the year, like what they're going to present. But like the biggest takeaways, I mean, it was all about GLP-1s. It was all about CGMs. Like that was an underlying theme. There were some highlights brought in about the abridged standards of care, because every year the ADA publishes guidelines for the treatment of diabetes, and the big full document's 250 pages, which is a lot to digest.
Too much.
But they have an abridged version for primary care that you'll find in the Clinical Diabetes Journal. That's a publication of the ADA.
Fantastic.
So they highlighted those. They talked about the costs of diabetes a little bit and how they've outpaced even cancer costs for treatment. Had the key speaker from the FDA spoke about that at the beginning of the sessions. But there were new guidelines out for treatment of hyperglycemic crises in the hospital. There were new guidelines out about early stage type 1 diabetes, recognition and progression, and then delay of progression, because there's a treatment for that.
Yep.
But when it comes to type 2 diabetes and our QI specifically, they highlighted some trials that I think that might be of interest to folks for like some summer reading.
Okay.
And then also,
we know you like to do some summer reading.
I do love summer reading. And then other things that were of interest, Dr. Hughes from OU talked about accessing diabetes technology for people who are blind.
Wonderful.
Because as a population we don't always think about.
Yep.
And then they have different interest groups, and I always go to the ones on reproduction. They talked about CGM use and diabetes and pregnancy. And then my other favorite was diabetes and primary care.
Nice.
Because Dr. Jay Shubrook, who used to serve our area as a clinician, was there, and he represented the American College of Diabetology that is promoting improvement of diabetes care in the primary care space So, I mean, it was an exciting meeting.
That's fantastic.
Lots of things going on.
Give me some more details about the GLPs, if that's the one you think would be most beneficial.
So for GLPs, there was a session where they talked about facts and fiction about GLP-1s, and so they led with the side effects that we're all familiar with. You know, the GI side effects are what we always see in the trials.
Oh, yeah.
Nausea, vomiting, diarrhea, constipation.
Oh, yeah.
And some of the ones that we worry about a little bit more, pancreatic cancer, pancreatitis, they talked about thyroid cancer, and kind of came to the conclusion that they're not all that common, and actually there's improvement to those types of issues with pancreatic inflammation, and that the type of thyroid cancer, the medullary thyroid cancer, is just so rare that you're probably not going to come across somebody with it anyway.
I think that is so interesting, because for years with GLPs, there's been such a push to avoid that with pancreatic insufficiencies, and that's exciting. That's exciting.
But people probably still would not be comfortable doing that, and I probably still wouldn't do that with somebody that had a history of pancreatic issues like that.
Chronic pancreatitis or something along those lines.
Yep, I'd still not use them. But then they also, at that session, they talked about ways to help patients tolerate them better.
Oh, I like
when you
that.
Start them.
That's interesting.
It was interesting because they are such useful medications. I swear, after some of these trials, which we'll highlight here in a moment, that they want them in the water like they did the statins like 20 years ago.
I have feelings on that, but
it's okay to have feelings about that. It is okay.
Good and bad feelings. Good and bad feelings. Fantastic. Okay, so the GLPs were a hot topic.
They were a hot topic.
Any particular trials that you might recommend someone look at or read?
The STEP HF PEF trial, which is the heart failure trial. So it's preserved ejection fraction heart failure, and the use of semaglutide. They actually found that it was beneficial.
Okay.
They highlighted two different trials. One that was actually resulted in 2023 and led to semaglutide being approved for the use of heart failure, and Medicare covering it this past year.
Okay.
And then they talked about one more specifically about diabetes and obesity with it, but it's semaglutide 2.4, so actually it would be brand Wegovy.
Okay. Okay. Interesting. Any other trial? Good summer reading.
Good summer reading. They talked about the FLOW trial. That
Okay.
was where they also, again, looked at semaglutide.
Okay.
And it showed that there was benefit in people with diabetes-associated kidney disease.
Oh, nice.
With its use.
Okay. Fantastic.
And then when we look at our dual incretin friends, the little bit newer class of medications, tirzepatide, they did follow-ups to the SURMOUNT trials. So, they started with the SURPASS trials, which
Okay.
showed how well it worked for glucose. And they followed up with SURMOUNT 1 and SURMOUNT 2 and looked at weight reduction in people with and without diabetes in those two trials.
Okay.
And this was the SURMOUNT OSA trial. So it was the use of tirzepatide for people with obstructive sleep apnea.
Okay.
And this one had more.
Interesting.
Yeah, it had more men in it than the other trials because these trials seem to attract women because of the weight loss profiles. So they actually have to cap the number of women in the SURMOUNT trials. But this one actually was 70% men looking at
Interesting.
obstructive sleep apnea.
With sleep apnea. Mm-hmm. Interesting.
And they had groups that were placebo, a group that was on tirzepatide, and then there were people that were both using CPAP and not using CPAP in both groups.
That's so interesting.
And they were looking at the apnea-hypopnea index.
Wow.
And it improved with the use of in the tirzepatide group, both on and off CPAP. So they were saying that this could be a treatment for sleep apnea, but the main reason is probably because treatment for obstructive sleep apnea is weight reduction, and the treatment arm did lose 20% of their weight over the course of the trial.
Wow. It is so interesting.
But still very, very interesting.
Awesome. That's awesome. All right. So it seems like what we have is that there's a really nice summary in the ADA, the guidelines, and there's an abridged ADA summary out there that is easier to manage compared to the full standards of care. We also know that diabetes has now increased the cost above cancer at this point. There's some meds out for early stage detection for type 1. And some of the big takeaways for summer reading are going to be mainly on GLPs, which would be the STEP-HF, the FLOW, and the SURMOUNT OSA trial. Is there anything else you'd like to add about the conference that you think our physicians might find interesting, or providers?
Another topic I found interesting was they presented the first part of the CATALYST trial. The CATALYST trial was where they looked at the number of people with hypercortisolism with diabetes, and they actually found that about 25% of people with type 2 diabetes in this trial actually had elevated cortisol levels too.
That is so interesting.
Yeah.
So like a diagnosis that's being...
More like maybe a pseudo Cushing's, not necessarily full on, Cushing's where someone's got really high, obvious cortisol levels. So there's a push now to check that, especially in patients that are harder to treat. Their diabetes. Really insulin resistant.
What trial was that again?
It was called the CATALYST trial.
The CATALYST. Okay, I did write that down. Okay, awesome. That's exciting.
Yeah.
All right, so we found some summer reading for our care providers out there, and a really nice highlighted summary of what happened at the ADA this year. All right, folks, that's it. There'll be some summaries of some of the trials attached to this newsletter, and until next time.